This is Christine Koh from Carestream. I'm here with Brian Casey of M80.com. You know, your primary resource in the marketplace for imaging and imaging IT news. Welcome.
Great. Thank you, Christine. Great to be here.
It's our second day here at HIMSS 2013. A lot of talk about what's hot and what's new. From your perspective, you know, what are you seeing and what are some of the folks talking about, and what should the IT folks community here take away as they leave HIMSS?
Yeah, the thing that I'm really seeing a really strong trend here is in vendor-neutral archives. I've been mostly talking to radiology vendors here, and everybody is launching a new VNA offering or tweaking an existing offering. I mean, there's really been a lot of discussion about VNAs. So at least approaching HIMSS from the radiology angle, I'd have to say that the VNAs has been the number one trend here.
Okay, excellent. And so with that, why do you think that is? Why is VNA a hot topic for the IT folks?
Well, I think it is being driven by the IT people, and the IT people are kind of looking at PACS and radiology images, and they're sort of saying, all right, you guys have had these data silos for a long time, but now the rest of us want to get access to your images too, and you need to put them in a format where we can see them.
Absolutely.
And so I feel like it's being driven by the IT people, but I think it has a lot of benefits for radiology because it's getting medical images out there throughout the enterprise. It's making them a little bit easier for them to be viewed by other clinicians. Yes. So I think it's a positive trend.
And that certainly coincides with the speaker from yesterday, the keynote from University of Virginia, where he talks about how imaging should no longer be a silo.
Exactly.
It really should be part of the enterprise IT strategy to be able to not only consolidate for cost, but also provide better access.
Exactly, exactly. And I think that some people in radiology might be a little uncomfortable because they're maybe losing a little bit of control over the images, but I think in the long run it's better because it's making images easier to access through things like universal viewers, and it's really pushing the medical images out throughout the healthcare enterprise in an easier way to access.
Fantastic. Now I know that there was also a HIMSS leadership survey that was just published. Your thoughts on that?
Yesterday, Monday, HIMSS published the results of their annual leadership survey, and they surveyed several hundred people, December through January, I believe, for their thoughts on top issues in IT. And for the second year in a row, staffing was the biggest concern among the people they surveyed. 21% felt that staffing issues would impede their ability or were a barrier to their ability to accomplish their IT goals. And that number was the same as last year, 21% also. So the problem's not getting worse, at least.
But it's not getting any better either.
Well, it might be, because another finding was that 51% said that they expect staffing changes in the next year. And that sounds like a high number, but that's actually down 10 percentage points compared to the year before.
Oh, wow.
So it actually looks like there's a little bit more stability in the workforce, and hopefully that will have some positive things for us. Another thing that came up was that with the staffing is that IT folks are spending so much time on two big areas, achieving meaningful use and on ICD-10 compliance next year, that they're kind of having to put off some other projects.
Right. Wow.
Now, another big finding had to do with security, with data security. In the most recent survey, 4% of the people surveyed said that they felt that their security systems were inadequate. So that was actually down quite a bit compared to the year before, when 32%. So they're getting a better handle on security. The one problem is this trend of bring your own devices that's developing, where people are bringing in tablets and phones, and they want to access images on them. And there was a clinician from the press conference yesterday that said that apparently at her university they have some of the medical students are as young as 18 years old.
Wow.
And so you can imagine teaching
all sorts of devices.
All kind of crazy stuff. So that was a big issue, and I think that's something that's going to take some work for people to get a handle on.
And us, I think, as imaging or vendor providers, I think something for us to think about too, as we, how do we figure out how to help our customers solve their problems and challenges.
Yeah,
so
definitely.
Thank you so much for sharing that.
Thank you, Christine.
Thanks, and that's it for us for now at HIMSS 2013.